Today, you're here for an MRI. That stands for magnetic resonance imaging, which is a lot of big words for pictures taken by magnets. The first thing that happens when you get to the hospital is you'll stop to check in at registration and your parent or guardian will fill out the paperwork. You will get a special bracelet to help the nurses and doctors know who you are. Now you'll go to the MRI waiting area and hang out until an MRI team member calls your name. Once an MRI team member calls your name, they will take you to a small room to review your screening form and make sure you're ready for your MRI. Your parent or guardian will come with you. Once you're ready, an MRI team member will take you to a small waiting room where you will wait to get called back for your MRI. Some patients need something called contrast before getting their pictures taken by the MRI. Contrast helps the doctor see what's inside your body in a better way. You get the contrast through an IV. An IV is a small plastic straw that goes into your vein to help your body quickly get medicine or a drink of water. When you get your IV, your one job is to help your arm stay calm and relaxed to make it as easy as possible. Once the IV is in, you'll get a sticker and some tape on top of your IV to help keep it in place. Now you're ready to go to the MRI room. Your MRI team will let you know when it's your turn. Before you walk into the MRI room, the MRI team member may check you to make sure you don't have any metal or jewelry. The MRI team member will go with you into the MRI room where the MRI machine is. If you brought a comfort item, ask a team member if you can bring it with you into the machine. When you walk into the MRI room, you will notice the MRI machine looks like a big metal donut. The MRI team member will help you onto the MRI table that looks like a small narrow bed. Your team will put a foam block under your knees and give you a blanket to help you feel more comfortable. They will also give you a pair of earplugs because the machine can get loud. If you are getting pictures of your head or brain, the team will place something that looks like a helmet over your head and give you some padding. When the MRI starts taking pictures, it can sound like a washing machine or a video game. Even though the machine makes a lot of noises, nothing will touch you or hurt you during the test. It's okay to feel nervous during the test. Someone from your team is always right outside of the room. Your team will check in with you through a speaker on the machine. Sometimes the table moves back and forth to help get the best pictures. If you have an IV, the contrast may feel cold in your arm, and that is normal. Since you're getting pictures taken, the most important part is to stay still so that the pictures don't get blurry. This test can take about an hour, so it's okay if you fall asleep. When the test is done, the team will let you know, and the table you're on will start to slowly move out of the MRI. An MRI team member will come into the MRI room to get you, and you'll walk out of the room. If you have an IV, then the MRI team will remove it before you leave. Once the IV is out, you and your parent or guardian will be able to leave. If you don't have an IV, then you can get dressed and you and your parent or guardian can leave.